Good afternoon, everyone. Thank you for being here. Why don't we go over some data points, hit on some various issues, and then take some questions. Unfortunately, we have lost another member of our community to COVID-19. He is a male, white male, Caucasian male, in his late 50s. He had significant underlying medical conditions. Our thoughts and prayers are with him and his family and everyone we've lost this week, this month, as it is very difficult for these families to grieve under the current rules and regulations. So again, the community mourns another loss of another one of our neighbors. We've lost 34 individuals to COVID-19. 26 of these individuals have been Caucasian, 4 of another race, and 4 African American. We've lost 21 females and 13 males. Related to new cases, we currently have 947 cases, up from 920, which is 27 new cases. We'll get into the new cases, what they are, what they represent in a minute. We have 39 individuals in the hospital. This is one more from yesterday. This represents 12% of our active cases. This number's going down a little bit more because we have more active cases. We'll talk about active cases in a minute as well. But our hospitalization rates have been going down. They're stable. We're in good shape. This is just part of this virus. As long as we have cases, we're going to have a percentage of individuals in the hospital because it's this virus is very disruptive, it's very powerful, and people are going to get very sick. We have 9 in critical condition. This is one more from yesterday. Again, we've been doing a lot of testing. We've been identifying pockets of this virus. We know right now in the community we have problems in senior-related facilities, and our seniors have gotten this virus in many cases, and it's very tough on them. We're going to have people in the ICU as long as the virus is with us. The good news is that this percentage has gone down pretty drastically, and so I think overall our data reflects that when it comes to our ability to treat people and help prevent and treat people, we're doing well when it comes to deaths when it's compared to other communities. We're doing very well, but it's still very painful when we lose our neighbors. Right now, demographics of those who are in the hospital, we have 21 Caucasian, 9 African Americans, 2 of another race, and 7 individuals who have not shared their demographic data with us. Today, there are 574 people who have recovered. That's our green curve. That's up 13 cases, 13 people who once were cases. And a recovery now with seniors now, the guidance has changed related to recoveries. Remember before, the guidance is 7 days of no symptoms, 3 days of no temperature, you then qualify for recovery. We are now, with our seniors, we are now extending that to 14 days. So there needs to be a trend of getting better for 14 days before we're going to remove from an active case to a recovery. So our active cases, what do we know about our active cases? We know that 70% of our active cases, which are now at 339, that's up 13, are related to seniors and or contacts, a household contact. So our active case number is going to remain pretty stable because most of these individuals have come on in the last 2 weeks, and most of these individuals are senior citizens. So we're not going to, the guidance is now you're more conservative with our seniors. Why are you more conservative for recoveries? Is because they can respond from COVID-19, but their immune system is weak and then get sick with something else. So we're going to watch our seniors for a 14-day period before they are off of the active list onto the recovery list. So again, 339 is our active caseload. 70% of these are related to affiliated cases in senior buildings and or household contacts. When we look at our new cases, we have 6 new household contacts out of our 27 new cases. These are folks that are already in a quarantine because someone in the household already has COVID. So you don't need to go and do an investigation. The workload on our health department is not nearly as much as a regular community spread case. And in addition to that, we've already baked in internally the fact that we're going to have household contacts once you have a positive case. So 6 out of the 27 household contacts, 10 out of the 27 are affiliated with senior living facilities, nursing homes, and assisted living facilities. So we have 16 affiliated or contacts. We have 11 community spread. So the community spread is something that we watch very closely. That's the randomness of the virus in the community. If we see community spread trending in the right direction, that means we're all doing a nice job with physical distancing and wearing masks and taking mitigation protocols, washing hands, good hygiene. When certain assumptions are made, when the community spread cases go north, go the wrong direction. So when we look at our trends for the community spread cases, we stabilized last week. This week, we've gone down a little bit. Out of the community spread cases, there have been a couple cases where folks have been in settings that we would not deem to be appropriate related to larger gatherings. So we know there's going to be a lot of pressure for this moving forward as the weather gets nice. We just ask people, you need to be smart. You've been smart. Our data is where it is because of you and because of the work from our health department and our medical infrastructure and all of our first responders. But we need you to hang in there and continue to be smart. This virus is going to be here. We're going to talk about a restart. We're going to talk about economic recovery while the virus is still here. You can still get sick. So we need people to really take care of themselves and their families. So looking at, we now have a little over 1,000 people in isolation and quarantine. That number's been pretty stable all week, been between 950, 1025 all week. Again, once we have some of these seniors come off the active into the recovery, we'll see a big drop in that number. When we look at our positive cases, some of the data related to them, 540 are female, 407 males. 29 are under 19 years of age, 166 in their 20s, 120 in their 30s, 130 in their 40s, 154 in their 50s, 147 in their 60s, 90 in their 70s, 74 in their 80s, and 37 in their 90s. 21% of our cases are under 30, 33% are under 40, 47% are under 50, 63% are under 60, and 37% of our cases are over 60 years of age. Breakdown by municipality. City of Syracuse, 457 total cases, 238 recoveries, 219 active. Town of Clay, 85 total cases, 63 recoveries, 22 active. Town of Manlius, 54 total cases, 39 recoveries, 15 active. Town of DeWitt, 49 total cases, 31 recoveries, 18 active. Town of Salina, 42 cases, 32 recoveries, 10 actives. Town of Camillus, 35 total cases, 28 recoveries, 7 active. Town of Cicero, 33 total cases, 26 recoveries, 7 active. Town of Gaddis, 29 total cases, 21 recoveries, 8 actives. Town of Lysander, 28 total cases, 18 recoveries, 10 active. Town of Pompey, 21 total cases, 20 recoveries, 1 active. Town of Skaneateles, 15 total cases, 13 recoveries, 2 active. Town of Van Buren, 6 total cases, 3 recoveries, 3 active. Town of Lafayette, 4 cases, 2 recoveries, 2 active. Marcellus, 4 cases, 4 recoveries. Atisco, 4 cases, 4 recoveries. Elbridge, 2 cases, 2 recoveries. Fabius, 2 cases, 2 recoveries. Spafford, 2 cases, 2 recoveries. And the town of Tully, 2 cases and 2 recoveries. Geographically, the data shows that if your community hosts some of these buildings that we've seen spread, you're going to have more cases. Once you break out those buildings, you look at your population, it holds pretty true with the rest of your cases. Testing, we got some better data, so we'll share it with you. There's still a margin of error in here, but we got enough where we think it's worth talking about. We've tested, the only test numbers that aren't in here related to total tests are what the state of New York has done in nursing homes. We have those positives, but we don't have the negatives in this number. So other than that, we've had 12,677 tests administered. 11,847 tests have been returned, 947 positive, 10,900 negative. We have 830 pending tests. These are largely due to the proactive testing that's been done. So there has been proactive testing by New York State done in nursing homes. There has been proactive testing done by Onondaga County in assisted living facilities, independent living facilities that had cases. We are now at the point where through next week we'll essentially be done with the assisted living facilities, and then we'll gear up for the independent living facilities and some other dense buildings in our proactive testing strategy as we move into restart. But essentially, what we've been seeing is the facilities that had cases, we've seen some asymptomatics, and we've seen some light symptoms come back positive. We have not seen a lot of these other facilities that we've done proactive testing in. So again, when you look at the risk to the community, it's still here, but our new cases have been concentrated in specific buildings. 8% of our results essentially have come back positive. When we break out the Walmart data, we said that might be interesting to look at because that was the first real data point where the way you get a test is light, is a little bit lighter, more liberal, and we were sending folks that we knew were asymptomatic there. The percentages of positives are under 4%, so that makes sense. Gaps in an investigation, we talked about this. I have another, there's going to be a release coming out, but we have another case where we had an employee. Let me go through. This is a new case of this employee, and I'm going to go through both when they worked and the bus route that they took to work. And again, this will be on our website, www.ongov.net/news as well. So we had an employee. He was wearing he or she was wearing a face mask. I don't know the sex. And the store has been adhering to CDC guidelines. Walmart, located at 6438 Basil Row in East Syracuse. The employee worked on April 20th, the 21st, the 22nd, the 24th, the 25th, the 27th, the 28th, and the 29th. If you were shopping on those days, please be very cognizant of your symptoms. Contact your doctor if you have questions. If you took the Central bus using routes 216, 120, 123, or 116, again, that's 216, 120, 123, or 116, on the following dates, we just want you to be very cognizant of your symptoms and contact your doctor. Again, this individual was wearing a mask. This does not mean you had direct contact with them. So if you were on those bus routes on April 20th, 21st, 22nd, 24th, 27th, or 29th, please be very cognizant of how you feel, your health, take your temperature, questions, contact your doctor. Again, that press release and all that information is on our website, www.ongov.net/news. Looking at physical distancing, social distancing, certainly tomorrow is going to be a nice day. The strange abnormal object It's orange. It will be in the sky. It's called the sun. It will be back here tomorrow. Certainly, we encourage people to take advantage of this, get some lawn work done, you take a walk, but please be cognizant of the fact that the virus is here. It can't swim in 6 to 7 feet of water, so it's good to stay 6 to 7 feet away from people. Wearing a mask helps, and certainly, having a mask with you, even if you are taking a walk or a jog, and you come by people, it makes those people more comfortable. Trust me, I get the emails. So we're saying all this because we know as this process moves forward, we're moving forward towards a restart. The weather's going to change. It's going to be nice. We just need to continue to take advantage of the weather. We need it for our mental health, but in a smart way, in a safe way. Okay? Related to restart, we can take questions on this, but again, we've worked with our regional partners. We are exchanging ideas and concepts with the state of New York on a daily basis. We have met and or can meet all the metrics that have been put in place by the state for a restart. We are well positioned to lead in this area for the state, and we expect to. So we're very excited about the work that's been done by our teams collectively from our partners in Central New York and the Mohawk Valley. We heard the governor talk about schools being closed till the end of the year. Again, this was very important that this was a state decision, because if you think about curriculum, you think about continuity of learning, all these things, state education is the regulatory agency. It's different from regional decisions. So certainly we understand the decision that the governor had to make today. When you look at the risk reward, there was certainly no way that schools could be opened up in May. So how much school timing was left. We're very sympathetic for our seniors. We'll think internally with the school districts about ways we can especially recognize our seniors for really what is unprecedented times and how they've been cheated by this virus of what are really very strong memories. So certainly we'll think about some special ways at the right time how we can honor our high school seniors, as we're very sympathetic for what they've lost in this process. Other states are starting to reopen a little bit here and there. We're going to watch it. We're going to learn from it. Every little day we learn a little bit more about this virus, and that helps us with our mitigation strategies and process, especially when we have things opened up. Our child care program for essential employees, again, we announced yesterday, we're extending it through the end of May, through May 31st. That means if you are an essential business employee, you're going back to work, you're running into daycare, child care issues, you can utilize our slots that we have available through Child Care Solutions. Speaking of Child Care Solutions, their phone number is 315-446-1220. Upstate Triage line, 315-464-3979. If you are having symptoms, you call this phone number. They will screen you for a COVID test. You then come to the Syracuse Community Health Center, and we get you tested. Seniors, healthcare workers, and adult nutrition hotline, 315-218-1987. This is a hotline that we put together when we were getting feedback in the early days about the fact that seniors aren't supposed to leave their homes. How are they going to get groceries? We need a meal. All these various things. We extended that to our healthcare workers, essential businesses, and really it's been a hotline that has been dealing with everything, including now mask requests. So we're filling the gaps where we need to. Again, social and emotional support, key to this process moving forward. 211 is a great resource to call. 211 if you're having a issue to talk about strategies, talk about referrals. Please do that if you need help. That's what it's there for. Questions?
5 straight days of briefings and 5 straight days where you've had to announce deaths. How do you handle delivering that news?
Yeah, you know what's hard about this is there are people who we have our victims of COVID, but there's people who have lost someone recently in this time period, whether it's COVID related or not, understand how hard it is to grieve. If you were in a situation where you had a relative who was hospitalized, you can't see him, and then or friend, and then you lose that person, and it's natural to want to be together and remember and honor that life, and you can't do that right now. So the loss of life is very painful, Andrew, and then I think which is additionally painful is the fact that people just can't be together to honor their loved one the way that they need to be honored. They have to wait until this virus is an impact on the community is which that they can then get together. So it's very hard to talk about it and recognize what this toll this is taking on our neighbors. As good as the numbers are for our community, we're doing much better than everybody else. This is still really, when you think about it, and I look at the data, and I know there's going to be more people we lose. So it's really unbearable to think about that when you think about their families and how there's been such little communication. So it's very painful.
Are the deaths following the pattern you indicated earlier this week, basically the status of where this virus is, and it's hitting these senior care facilities, and I use that term generally, hitting them the hardest?
It is. And folks with underlying medical conditions, we've had people we've lost that did not have underlying medical conditions. But it's, once it's there and it gets a hold of you, it's got a tough and tight grip. So when we look at the data, we just look at the data, we know we're going to lose more people. And so that's very painful. That's why we're doing what we're doing with our proactive testing now, finding these asymptomatic carriers, because that's the only way we're going to stop this and minimize the impact on our most vulnerable. So that's the reality. We're going to lose more people. And it's, I hate some of these comparisons being made to other illnesses. This isn't like other illnesses. And there's no treatment and there's no cure. Our plasma project is giving some success and some hope to that. Some of these trials are giving hope to that. But this is different. And so I hate the comparisons to the flu that some people have made.
When it comes to the deaths, are those folks being transported to hospitals for their final days, or are some of them not even making it that far?
Yeah, some are not dying in the hospital. So most are, some aren't.
I guess the reason statistically for that is there may be deaths that aren't accounted for in hospitalizations before they become, that final tally.
Right.
You mentioned proactive testing again, and that being an important part of your strategy, but you're next week wrapping up the assisted living and then shifting to just general independent living. After that, what do you do next? I guess take me through your strategy moving forward, because at some point it sounds like you're having luck getting the ability to test, more capacity, and if you've done all of these senior living homes at some point, you can move on to something else after.
Yeah, I think you're going to have a consistent part of your strategy being your responders that have risk to COVID. So you're probably still going to be constantly doing hospital employees and healthcare workers, EMS providers. In addition to that, what we'll be looking for is other areas of density, other apartment buildings where that may have senior populations, just not designated seniors. And then you go and you look at the data and you see if the data shows any other stories. And is there different neighborhoods that might be impacted? Do you go and test certain pockets of certain communities? on a proactive basis. So right now the data tells really one story, and we got to get our arms around that. We in that process of doing that. Certainly our efforts have saved lives. There's no question. We found many carriers that nobody knew was sick, and so now we're in the process with identifying these folks, getting them the help they need, and by testing, you're finding these pockets, and once we're done with that, we get these people better. We move on and we figure out is there any other geographical or stories that the data is showing us. If not, then you look at these. Eventually, you look at probably various different things. At some point, I'm sure we'll be talking about testing teachers and school professionals as they go back to work, and various other things. Remember, we're gonna have to do 13,000 tests a month. We're gonna be very busy. We haven't even, essentially, the CDC medical guidelines for symptoms hasn't even merited in our county doing 13,000 tests. How many days have we been doing this? 50 days. So we're going to be doing a lot of proactive testing. So some of it will be strategic, some of it will be random.
Do you have numbers or an estimate on how much sales tax revenue the county's lost in the month of March?
We get a payment next week. That will be the first payment where it will reflect the actual shutdown period. So we were growing at 5% going into this. That's very good growth. Put smiles on my face thinking about that. It was great times. Our anticipation is, at minimum, what's going to happen is you're going to see a drastic drop off, and so you'll see your next 2 or 3 sales tax payments dropping off drastically, and then as the economy starts to activate at a larger level. Remember, there's many businesses still operating today. There's still consumer spending. I heard paint sales are up like 600%. Everybody's painting their rooms in their house. That's good. But you'll see activity increase, and you'll see our number go from negative really bad to negative really bad, and then hopefully negative really bad, and then hopefully just negative bad. We will never be at positive. And so when you look at that in numbers, we have increased costs due to COVID-19. We have lost revenue due to COVID-19. We're anticipating that those numbers are between $75 and $125 million.
And do you have any plans to make operational changes or budget changes as this kind of drags into spring and summer?
We've already made a bunch of austerity cuts and spending freezes. We have a retirement incentive which will free up some revenue for us. Certainly, once we know how bad these sales tax payments are in June, we're going to have to make a certain number of decisions based off of that. By June, hopefully we know what the federal government's going to give a local stimulus package, because that will help weather the storm. The last thing we want to do is let go of people, because if we're trying to talk about economic recovery, we're an employer too. We're your government, we're an employer. We want people working so that they get a paycheck and they pay federal tax and state tax and sales tax, and they go to a local business and buy product. So we don't want to get rid of people. That's the last resort. But we don't have the ability to raise taxes mid-year. So the ability to raise revenue is zero mid-year. So I can only do that through the budget process. So our only ability right now is to deal with the spending side.
And the city, I think, furloughed 104 employees, they announced today. Do you plan on furloughing any people, or do you know?
So what we've done is we've held lines, right? We have open positions that we've put hiring freezes on across the county. We took our 103 line, which are part-time workers, and we essentially, I think it was a month ago, maybe even longer, brought their hours down to 0. So you can call that whatever you want to call it. Those are people that used to be getting income. Now they're not from us. If they're 103, they're probably retirees, or this is a part-time job. We want to do everything we can to avoid our 101 liners are full-time employees. So we want to protect them every way we can. But again, our options are limited. If we get state cuts, remember the state of New York's talking about cutting us now mid-year too. If we get those cuts and then we don't get any federal help and we get all these losses, we have limited options. The options are bad. And so it's just a reality. I don't know how you cut us or don't recognize. This is the thing I've been talking about. When it comes to some of our leaders, everybody told us, everybody, president, governor, we agreed with their timeline that you got to be shut down through April 30th. I think, is today April 30th or is today May 1st? Okay, today's May 1st. So there should be no question about giving states and local government support through that timeline because everybody agreed. Everybody was in agreement. By not doing that, it's called an unfunded mandate. Unfunded mandates are not conservative things to do. That is a fiscally unconservative thing to do. So for my fiscal conservative friends in Washington, D.C., you don't do unfunded mandates by telling people you can't operate, and then you don't give them the revenue that they lost. So now, moving forward, I get it's a little bit more of a debate because some people are opening up, some aren't. But certainly through May 1, this should be a very easy process. What's the revenue you lost? What are your new expenses? Only one government can go out and sell treasury notes to generate revenue. It's the United States government, and they should be here to help us out.
That sales tax payment that you're getting, what period will that show the change in the economy?
Late March, early April. So that's right when it all began. You know, as far as when you're looking at severe shutdowns of the private sector.
Looking at the governor's timeline, May 16th is when things can start reopening. How do you prepare businesses? What kind of guidance do you give to businesses and then also the general public when we wake up that day? What should people expect? How much life is?
Yeah, there's a couple things, Doug. So right now, we continue to work with the state on loosening regulations on existing essential businesses. That's a good way to kind of walk us and jog us into restart phase 1. First is we got to agree on what phase 1 looks like for our region. So we're having those concepts. Everybody agrees on construction and manufacturing. The manufacturing and construction is going on now, but it's going on now in a limited basis. So we got to agree on what else phase 1 looks like. And then we've been working with Center State CEO, McNee, Regional Economic Development Council on messaging what the new standards are for businesses. There needs to be a communication strategy. Part of what our Central New York region is doing with our Mohawk Valley region and our restart plan, there's when you think of a flow chart, there's a communication arm to that where we will have people from all of our teams talking about how we communicate to the public and then how we communicate to businesses so that they are ready. Phase 1 will be less complicated than phase 2 related to that. So phase 1 is getting things going, getting people back to work, testing the virus, seeing how it behaves, because phase 2 is going to be larger than phase 1.
There was a pretty strong turnout outside of City Hall today, protesters pushing for the economy to be allowed to reopen. A few of them are taking digs at your political affiliation, your loyalty as a Republican. Have you had those conversations personally, and do you feel those digs are appropriate?
Look, I appreciate everybody's right to protest and their right to speak about what's on their mind. These are trying times. I get protested by 3 kids every day I get home. So there's a lot of things going on. The reality is none of these individuals, if they're questioning my street credit, look, none of them have my job, okay? And none of them have to come out here and talk about how we just lost another person to COVID-19. And none of them have all the information I have. And none of them, and again, for the Republicans saying I'm not a good Republican, you want me to open things up. I can't open up things. And I can do what I can do by working. And then if I think the state of New York is outside their lane on a decision, I move forward. I don't ask permission to do my job. But I will say this. The President of the United States said the way we're going to reopen up the country is through the governors. Last time I checked, the President was a Republican. So if the President was going to say we want to open up through the counties, maybe my plan would look a little different than the states. But we've been given a framework that we're going to work through. And so I laugh off the assertions that because I take this virus seriously and we let data help drive our decisions, that means I'm not a good Republican or a bad Republican or not a Republican, whatever they want to call me. I've gotten very thick skin through this process. And Cameron really tested me early on, remember? We had Cameron, and he was there, and we've had a lot of other guys really step up big time with my email inbox. So I'm used to it. The reality is that the rules were set by the federal government on restart, on who's in charge of restart, and the governor is. So that's where it is. We interpret guidelines that they give, and we give out guidance on those guidelines. And there's been a lot of businesses that have thought that they couldn't be operating. We give them guidance based off of our interpretation, and then they can operate. So we're doing everything we can to find that balance between the economic casualties of this virus with the public health casualties of this virus. And how do we find the balance so that we can start to limit the economic pain and damage, the damage on what some people view as their liberties. We've asked for sacrifice, and people have sacrificed. But it's not easy. For every person saying reopen the economy right now, I have as many people emailing and screaming at me that it's too soon. So we have to find that balance, and we'll find it. And at the end of this, we'll be stronger because we will work together in ways we never have before. And then we'll get things going to the point that they need to be moving forward.
Is there any part of the governor's strategy that you disagree with?
Nobody's going to agree 100% with each other in this business. And the state of New York and the county of Onondaga have worked very well together. And the state of New York has given us the ability to implement our own planning and whatnot because we're competent and we're the regional government. So certainly, I was asked this question earlier. Do I believe there's businesses that could open up earlier than May 15th? Yes, I do. Will I continue to make that and advocate for that to the state about doing that or loosening up regulations in this area so that this can happen? Yes, I will. I've been doing that this whole time. Elective surgeries didn't come out of nowhere, right? You have people like myself and throughout leaders saying, we can do this. Let us do this. Let us do this. But overall, I do have a respect for that whatever is done in Central New York will be the template for every other region in the state. There's consequences for what we do here for everywhere else. So I get everybody's frustration. I have to govern. I have to find that balance.
You mentioned construction and manufacturing as being the two that can reopen. Is that sort of across the board, you believe in?
Yeah, I think the governor's very comfortable with that. I think everybody understands that these are industries that are already social distancing and proving they can do that well. I haven't asked Dr. Gupta if we've had any cases from a manufacturer or whatnot. I'm sure if we do, they're limited. So I think and that's the key, any business that can social distance or physical distance, you should be able to get going and do it in a safe way under regulations and proper guidelines with PPE when necessary, with masks. So that's the point. And to the point of some of our folks who are protesting, if that's their argument, they're right. It's just you can't just turn on the switch on day one when the switch has been off. You got to develop that regulatory structure, develop those protocols, give the guidance to the business owners as well. So, but certainly we think those are the two big ones that can really get people going back to work and their supply chains going, because if they're going, their supply chains can now work. But there are other businesses that we think we can probably put into this phase one. We got to work that out with the state.
How close are we to phase one? Because in the last 4 days, that total active cases has gone up.
Yeah, so phase one has nothing to do with active cases. Those are our metrics that we use. Phase one is based off of the CDC guidelines related to hospitalization rates. Again, our active cases, if you look at the numbers, 70% of them are essentially buildings, with people that live in the buildings. Why do we watch active cases? To us, that matters because that's our ability to in phase one, go out and do the isolation, do the identification, the tracking, and the quarantining, essentially in a 24-hour window. So sure, we'd like the actives to be down more, but our community spread 7-day rolling average is the best we've had. We're disappointed that we have people in these facilities that are sick. We're happy we've identified who they are, getting them help, and quarantining risk. We're happy the community spread numbers are going the right direction. But certainly active isn't about restart right now. Active is about our ability to fight this and find these pockets. And we're going to have, this is the other thing, we're going to have positive cases until the virus is gone, or we have a vaccine or viral treatment, and then you can just treat the virus. So every day there's going to be more cases. How do we stabilize that and manage that number is basically how we interact as a public. When things are going, how do we interact as a public? Are we being smart? Are we washing our hands? Are we wearing a mask? Are we staying 6 feet apart when we can? These are all things that when we get going, we need to continue to really do, or else the caseload won't be 11 to 20 community spread a day. It'll be 20 to 40, and then you get over that 40 to 60, then all of a sudden you got yourself a little bit of a problem because your hospitalization rates start moving up, and there's triggers that slow everything down again, and your hospitalization rates are one of those triggers.
Since the governor's announcement today of the schools staying closed through the end of the year, have superintendents looked to you for guidance?
We're going to reach out to the superintendents and talk a little bit about what graduation looks like now, and work and try to figure out how graduation gets done. How do we do it in a safe way? Where do we do it? Protocols. And then we're going to have to work with superintendents looking towards the fall about how we're going to do physical distancing in schools. Very, very key logistic things. And if you think about if you're upset with why the governor did, I do not have a plan. We don't regulate schools, but our health department does not have a plan on how you can have all these kids in a building staying 6 feet apart. So from a logistics standpoint, without that plan, how do you keep them open? You could have waited till June 1 and then reassessed and made another decision, but you probably would make the same decision that the governor made today.
What's your message to some of those seniors who are graduating next month who might be a little upset today?
You have every right to be. It's not fair what's happened, but in life, we don't see pandemics every day. It's usually once every 100 years, so hopefully it's their only one they'll ever see. But there are things that are going to happen in life, and you're going to be challenged and tested. And I think that we recognize that something's been taken from them, and we as a community will want to be able to recognize them some way, in a special way, as they go on to the next chapter in their lives, whether it's the workforce, whether it's going to college. So I know seniors, I'm related to seniors in high school, and I know they're going to be bummed, and it's disappointing, but we want to work with them on the districts on figuring out a way to do graduation and do it in a way where it's memorable and they can have that memory. And look, we're all seniors, right? I think what we had the most fun summer of our senior year is going into our freshman year of college, if I remember correctly. I'm getting older. Maybe that doesn't happen anymore, but the seniors are still going to have a lot of time to make a lot of good memories.
Reflecting on the last 50 days, one of the first charts your office brought with you was the initial flatten the curve chart, the very generic flatten the curve. As much as people want these numbers to be zero, aren't we doing what we set out to do, flattening the curve, basically distributing the cases over a longer term so it's more manageable?
Yes, and again, if you look at the regional, it's not completely flat, but it's going this way. The only reason you see that uptick is because what we're doing now, other counties are doing now. Oneida County is looking at nursing homes, they're looking at assisted living, and moving forward, everybody's going to do this. We just started doing it first. Why is everybody going to do this? Because our job is public safety, public health, saving lives. So if we weren't doing what we were doing, that thing would be flatter. And our active cases would be almost at 100 if we weren't doing what we were doing. And we could say everything we wanted to say, look where the active cases are, but then there would be people dying because they got sick, and we would be finding out down the road they had COVID and were exposed to COVID. And then you ask yourself, could we have done something different? So I don't want to be in that position. That's why we're doing what we're doing.
Of the community spread cases, has the health department been able to trace the source?
Some of them are tough. Some of them are certainly a couple things, couple gatherings that probably shouldn't have happened. We're concerned about that when the weather gets better. And certainly if we see another type of affiliation between cases that percolates related to something that we have some ability to prevent, we'll look at that.
You mentioned some sort of alarm bells go off. Can you kind of go back at that a little bit? Like, you know, when you reach 20 to 40 as opposed to 10 to 20 maybe, and then you go higher.
Yeah, so we know today, Doug, that when we start our restart, we're going to see more cases. So if we have a community spread average that's 15 to 20, we know when phase one starts, that number is going to go up. We're going to be closely monitoring our hospitalization rates during that period of time, and we're going to have more tracers in that period of time. So that to Andrew's question about trying to figure out where it's happening, we're going to have more people doing really intense work very quickly. So we're going to be front loaded for this virus. When it happens, we're going to be more staff. We've been beefing up our staff this whole process. But Dr. Gupta has told me, phase one comes, we're getting more cases a week. So your happy downward trend each week is going away when phase one happens. So not what I wanted to hear, but she's telling the truth. And so the public should know that. And it's important that the public realizes it's still going to be here. And the only way it's leaving us is if it flies away to the southern hemisphere for a couple months in the summer, but then it comes back and we got to be ready. So we'll see what happens with that. So it's going to be here. We're going to have more positive cases. We really need to focus in on hospitalization rates and making sure that we're doing very quick tracing to make sure we're boxing in the infectious ability to spread.
Going back to the schools, now that they are closed the rest of the year, how does that impact the economic restart, working parents, young kids?
So you're talking about a period of time, right? Because for the most part, these school parents had to figure out daycare, childcare activities in mid-June, right? So we're talking phase one, May 15 to May 30th. Things go well. You look at phase two then. So we've extended our child care solutions program that long. We know more workers are going to eventually need more daycare slots. And so we'll be able to absorb that. We'll probably be able to absorb the next 15 days too. I think when you have phase three, you get to a phase three, whenever that is, that's when essentially you're bringing back the economy, maybe still in a limited way, but the whole economy's there. But that should time out well with when parents would have had to have had child care solutions for their kids not being in school anyways for summer break. So it could, I think in our county, we're going to be better prepared than most for that because of our robust planning with our child care partners, and certainly we'll have the ability to plan for potential surge sites for child care like we did before, and we'll have those plans ready.
I guess in that vein, have you had a chance to talk to like the Y or other places that do summer camps to make sure that, you know, those are still a go?
Yeah, I think certainly some of these summer camps later on will be probably operating, but you're going to have to do it in a different way, and you're going to have to thin things out a little bit. And so that's going to be more of a, I would say, phase 3 issue that has to be addressed. And then how are your traditional partners that handle summer camps, and which is child care for many families, how are they impacted? What's happening? How can they operate safely? That's something that we're, each week that goes on, we have more time and we know more. So it's easier to answer those questions with more time. Other questions? Okay, let me go through some data. We did this last month, but now we are, let's see, this is since March 17th, okay? 338,000 school meals have been prepared and distributed in Onondaga County. 101,000 meals have been prepared and delivered for our seniors and vulnerable adults. Think about that number. Nobody was doing that before. 22,000 meals and boxed groceries have been delivered in this process. People who can't get to the grocery store. That's a massive number. Think about how many bags of groceries you bring home, and think about that number. 853 child care slots have been provided free of charge to our essential workers. 211, we talk about it every day. 12,645 people have called to ask for help. 515,000 items of PPE have been distributed by our emergency management team. Think about that number. 515,000 items. The Upstate Triage Hotline has fielded more than 14,550 phone calls to get testing and to screen people for symptoms. 156 room nights have been provided to our frontline workers. Over 1,100 residents and staff have been proactively tested at our senior living facilities. 7,776 gallons of milk have been distributed to our community free of charge. That's a lot of milk. And all this is done because of our community's response and coming together. And I want to thank again these organizations for their great work, and that's why we are so strong. Certainly our school districts, Meals on Wheels, Contact Community Services, Upstate Medical University, Peace, United Way, the Allen Foundation, Salvation Army, Child Care Solutions, the Food Bank, Nescentia Health, the Syracuse Community Health Center, the American Dairy Association Northeast, the Dairy Farmers of America, the Church of Jesus Christ of Latter-day Saints, our grocery stores, our hundreds of volunteers, and of course, my local county workforce. I apologize if I missed anybody, but I know you'll email me if I missed you, and I'll get you back. And again, I want to thank everybody. These days are tough for everybody. We have, when it comes down to numbers, some of the numbers are good, some of them are painful, but we're moving forward. We're moving in the right direction. We're moving towards that restart, and we'll be stronger together. So thank you, and be safe.